but the union makes us strong. Solidarity, solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. Viva Kempidu, viva!
Viva!
Thank you.
Thank you.
ETV Africa News at this hour.
It is the entirety, because when you're not covered like now, if you go to any hospitals, be it public or private, you'll use out of pocket. Because as we speak today, SHA is not covering any civil servants. And they're saying that there's delay in remittance. That's on one side. Even if the monies are remitted, we had concern when we came here on 3rd that despite the remittances at that time, though now it's an excuse, we would go to the hospitals and we're being turned back because none of the hospitals was accepting SHA. And there are different reasons. But on this side, we have our monies being deducted. When you come to the public and to the general Kenyans, the biggest problem with SHA that we have noticed is the outpatient services. To the point that hospitals have recorded expiring of drugs. We have a case in point, Nakuru County Level 5, where patients used to come in big numbers. Now when they come to the hospitals, they're being referred back to Level 2, Level 3 facilities that don't exist. So you end up going to a private facility nearby, or you're being told to pay out of pocket because you've not been referred. So the referral system of SHA is not working. And therefore it makes many people not able to access this care. The other thing was the co-payment. We have had many complaining that yes, you have SHA and you go to the hospitals, you've been done for a procedure at Kenya National Hospital, then you're asked to pay extra. Because whatever was covered is maybe 10-15% of what ought to be covered. So the benefit package has been a problem. And it's not an issue that we've raised today. We've raised it now and again from last year. And they say that they will review it. And in their claim to review it, they're not saying they're reviewing it instantly. They say they'll do it in 2 years. So who will be waiting? How will people get the services? Those are the concerns we've been bringing. So ideally, SHA will not work by rhetorics, by debates. It's worked by a simple thing that if you are covered, you go to the hospital, you get the care, you get paid, and you're okay. And that is the real backbone and definition of UHC. UHC doesn't mean so many things or many language or many words that they're using. It's just that regardless of your socioeconomic status, if you go to the hospital, you'll get the care. And the highest standard of care that's possible.
Also for the medical cover,
Yeah.
there's that MAKL that is covering teachers and police officers. Was there an attempt for change of medical scheme? Or what is the reason that MAKL is not really working with civil servants?
Actually, it's the cartels of MAKL that have seized SHA. That's why it's not working. And we had complained from that since 2023. The same persons who are managing MAKL have interest and were out to procure the system that is actually handling SHA. They're the same people, actually. And you realize that they own a group of hospitals in the country. So they are the insurance providers and the owners of the hospitals. So they will tell you, you go to a particular hospital, they don't cover you. But then they direct you to a particular hospital that they want to cover you there. So in case you stay somewhere where that hospital doesn't exist, how do you get the care? You must use out-of-pocket expenditure. So those are the concerns. The same individuals in MKL are the same individual messing up with SHA. That is the truth. You can investigate further. Yeah. That's what we keep on saying, that we have government that prides in politics, in lies, in talks, with no ultimate point to make things move. We've seen all the government officials running, say, elter-skelter, the ministry, the parliament, complaining about this and giving reports on the same matter. That the action by the US president to freeze or to do away with US aid was giving them a budget cut of 30 billion. And there was a worry. But then we have seen again yesterday that they are themselves reducing the budget with 73 billion. So that is a show that they had excess budget. We had strikes last year because the intern doctors were not being posted or the salaries were reduced by over 70%. The concern was the Ministry of Health budget was less, that they couldn't afford to accommodate the wages as per the CBA. We have postgraduate doctors that are training that fees have not been paid for ages. So yes, as we have issues, we have strikes with the ministry or with government, they keep on saying the budgets are less. But by the action of Parliament, it seems they know or have a different understanding that maybe the budget of the ministry was more than it should be. But for us as a union, we say and we believe health can never be free. Somebody must pay for it. So the moment the budget cuts are done for the Ministry of Health, it means it's done at the expense of the health of Kenyans. It means that somebody somewhere else will have to go deep into the pocket to get that care. So that's the reality. But for us as a union, we also put it clear that regardless of the budget cuts, we can never compromise on agreement that we've done with the ministry. They have to get money somewhere and ensure that the interns are posted at the correct rates, that the trainings for postgraduates are done, that all the agreements that we've done for our members are sorted out. That's the reality. But again, it's upon the government. We know very well that with less budget, expect, I would say, useless healthcare. That's why the previous years we had budget of about 7 billion, 7% to GDP. When it has been reduced, we've been seeing problems and problems. When last year's budget was reduced in healthcare, we've been seeing problems. And therefore, we can tell everybody that expect catastrophic problems in the healthcare of the country if budget is cut. And that's the reality.
Maybe from where you sit as KMPDU, as far as the referrals are concerned, maybe what is your proposal? Because if you can go to a level 5 and you are referred to level 2, should that be an immediate review of regulations of SHA?
We have brought that because the model that has been put in SHA is something that will work in an environment where there are actually functional level 2 hospitals with doctors, with nurses, with all the health workers, that with drugs, level 3 the same way. But in our setup, we know what is in existence. In those level 2 facilities, level 3 facilities, there's nobody. They're just a building with nothing inside it, maybe only one person to see everybody. So when you are referred back there, it means that you're being sent back home. So this referral system will have worked after some time if government intentionally invested in the level 2, level 3s to actually function, that people can be referred to level 4s and level 5s in the right way. But some are being sent back home to die. That is the biggest problem.
SHA is fading for civil servants and the general public.
Yeah.
Alternative financing models.
What is failing everybody is that the people that are mandated to make sure things work are not interested to make things work. Because SHA is just a name, but then the persons that have brought it up, that actually removed NHIF, they need to make it work. So essentially the money should not be diverted to anything. The money should be paid to the hospitals. The money should be paid for the services that have been done. The money should be paid for the patients. Thank you. The story is there for our social health authority, but then we have another concern. We have noticed with concern, this is a different story, at the Kenya Medical Practitioners and Dentists Council, that they have decided to go rogue. That KMPDC has decided to equate the dentists with the cohorts, the community oral health officers, diplomas. And therefore, we've just learned that if KMPDC is meant to regulate the professionals, why is it taking a center stage in this regulation and promoting quackery in the sector? That a training for a dentist is quite different with the training for community oral health officers. And the job descriptions is different in the same manner. Just the same way a pharmacist is different from a pharmaceutical technologist, and the same way medical practitioners is different from clinical officers. And that is the reality. I mean, that's why there are universities and there are colleges. So we are wondering why a body that is entrusted with regulation will decide to turn into cartel, will decide to turn into, there's no amount of politics you can do, there's no amount of lobby you can do, there's no amount of noise you can do that will make your diploma turn into a degree. You just have to go to school. And that's why we are saying KMPDC need to come in order. But my brother, Dr. Kaura, will add more.
Okay, thank you. Well, you have heard our regulator in the profession. That is the person who issues licenses to all doctors in the country. Doctors who are proficient in the field of trade is out to do harm to the public. And how they are doing this is by issuing anybody, whoever comes along and pays some little money with the doctor license. Doctors undergo rigorous training to provide healthcare of the highest quality to all of us. Be it a medical practitioner, be it a dentist, be it a pharmacist. There are standards of training and professionalism that must be upheld. But the regulator has decided to go rogue. They have decided the standards no longer matter, professionalism no longer matters, and when you pay money, you will get your doctor license.
It's being bought.
And that's why, if you go on the internet today, the other day you had someone died somewhere when they were having a procedure that they were not competent to perform. I don't know whether you still remember that story in one of the spas somewhere. Now a lot more is happening on Instagram, on TikTok, on Facebook, on Twitter, on X. All this that is happening there is misregulation of healthcare. You are being touted, services are advertised to you to come and get seen. And the persons who are seeing you have backdoor licenses to provide that care. But woe unto you, because when mishap happens, you will be the one to suffer. So as doctors in the fraternity, as dentists in the fraternity, as pharmacists in the fraternity, we speak against misregulation of healthcare. Kenyans deserve the highest standard of healthcare. Nothing less, nothing short of that. Si afya bora, bora afya, and afya yenye inafaa. So like we say, we give notice to the KMPDC that whatever they've done, without stakeholder involvement, without taking care of your interests as citizens, they should withdraw, and the Ministry of Health should advise them henceforth. That's an immediate notice. Thank you.
Let me just add one thing. Yeah? As a government, we must stop this thing of poor healthcare for poor people, where we just offer something for the sake of it. When you get to the hospital, you want to trust that whoever is going to be treating you is qualified and competent. As a patient, you might not have the capacity to know that. And that's why we trust government to provide a body called KMPDC to regulate the quality of care being given. But when the very, very government decides to abdicate its duty, then we get afraid. There's something called curriculum for every healthcare worker, and it's well disagreed how they train. How clinical officers train is different from how medical doctors train. How the oral health officers train, different from how the dentists train, and same with pharm techs and pharmacists. It's like if you are given a hammer, to you every problem will look like a nail. Even if you are giving a screw, you still be knocking it. So these cohorts have been told just how to uproot tooth. So for them, any tooth hurting, you uproot. Nothing conservative. Sooner or later, we'll have toothless Kenyans. Same thing has happened with OBGY services, where every other clinical officer is now doing cesarean section. And we ask those people allowing them that, would you allow your wife, your sister, to be on a table to be done for a CS by somebody who didn't train for it in the name of Bora Afya? We are hurting Kenyans. And remember that this licensing, this training is not about when things go right. Anybody can fly a plane, but it takes a pilot to fly it when there's trouble. No matter how many years you fly a air stage, you can never be a pilot. No matter how many degrees you get as a clinical officer, even PhD, you won't be a doctor. If you want to be a doctor, you have to back and train as a doctor. So we must stop killing Kenyans. We must stop offering poor healthcare for poor people.
Good. Solidarity bwana. We sing a bit.
We must sing a little bit.
Sing a
Yeah.
little
Although siku hizi mnakata hiyo part ya wimbo.